Hello and welcome to the Medicine Box. I'm your host, Ekta Batra. Today we are addressing a deeply worrying and increasingly common trend, the rise in sudden cardiac events amongst young Indians. It's no longer rare to hear of someone in their 30s, 40s or early 50s seemingly healthy and active collapsing without warning at the gym, at marathons, at concerts, at home and not getting back up. These aren't just statistics anymore. They're people we know. From Ranjan Das, the 42-year-old CEO of SAP India, to 39-year-old banker Amit Kasat, 40-year-old actor Siddharth Shukla, 41-year-old cardiologist Dr. Gaurav Gandhi, 50-year-old singer KK. From a 19-year-old in Ghaziabad, a 24-year-old constable in Hyderabad, to a 35-year-old gym goer in Himachal. And most recently in Karnataka's Hassan district, 23 people between the ages of 30 and 55 died of heart attacks in just 40 days. What's truly alarming is that in many of these cases, the heart attacks were silent, with little or no warning, no obvious symptoms, and often no prior medical history. Sometimes the collapse happens just weeks or months after a clean bill of health. So what's really going on? Is it chronic stress, lack of sleep, poor lifestyle habits, hidden genetic flaws, post-viral complications, or overexertion unmasking a silent underlying condition? And perhaps the most unsettling question, could this happen to any one of us? In this episode, we break it down. Why are these events happening? What role do supplements, sleep, stress, and unseen genetic vulnerabilities play? And what exactly needs to happen in those crucial seconds or minutes after someone collapses, because in many cases, CPR and access to an AED can mean the difference between life and death. Joining me are Dr. Ashwin Mehta and Dr. Ashok Seth, two of India's foremost cardiologists, because today we're not just telling stories, we're asking the questions that could save a life. Joining me are Dr. Ashwin Mehta and Dr. Ashok Seth, two of India's foremost cardiologists, because today we're not just telling stories, we're asking the questions that could save a life. Dr. Mehta as well as Dr. Seth, welcome to the show.
Thank you, Ekta.
Well, Dr. Mehta, let's start with you. What is your reading of events where young, seemingly healthy individuals collapse at gyms, marathons, or in environments where they seem to probably be pushed beyond their limits?
This is an enigmatic problem for cardiology fraternity also. The reason is when the coronary arteries get choked up by the deposits of fats and cholesterol and etc., till they are clogged up to 70%, no symptoms occur. So the patients or the normal person, or I might say not even a patient, does not see a need to see a doctor. And even if I do his tests, they may turn out to be completely normal. What happens is when a non-flow limiting obstruction suddenly ruptures due to external or internal stress, the one which is 40% blocked, that block becomes almost 100% in a matter of few minutes or hours. And that produces sudden heart attack. And 33% of the people, sudden cardiac death is the first symptom of heart attack. They don't get a chance to even contact a doctor. That is very enigmatic. So people who put themselves to an exercise or a gym where they're exercising, suddenly the blood pressure and the pulse rate go up. And the rate of rise of pressure and the blood pressure, the combined product, puts so much of stress that the plaque ruptures, a soft plaque ruptures. And what is 40% becomes occlusive to 100% and produces heart attack. That is the problem.
Many of the times, or most of the cases that we hear about, is that the person is at the end of the marathon. The person is at a gym and it's been a very intense workout, or they've been at a concert and it's, a high intense environment also when at a concert. So give us a sense in terms of why exactly it happens towards the end of a certain event, rather than, at the start where the stress is not probably that much.
Exactly, to some extent, Dr. Mehta did explain that. these people do not know that they have blockages in the arteries of the heart. The blockages in the arteries of the heart do not cause any symptoms till they grow beyond 70%. But extremes of exercise, like heavy weightlifting, like severe running, like even marathon running, or in a constrained and very sweaty atmospheres, a performance to the extreme where the heart rate goes up and the blood pressure goes up will suddenly cause that blockage to rupture and a clot to form on the blockage, suddenly blocking the artery up and creating a heart attack. It's almost like a drain where there was a narrowing and but still the water was flowing, and suddenly kachra got stuck on it, and suddenly the flow to our pipes stopped. And that is why that sudden, and when it comes suddenly from a 40-50% blockage to suddenly 100% blockage, then the chances of not just the heart attack does happen, but the chances of it presenting as a cardiac arrest are a lot more. And that is why we say that those who want to go to extreme exercise, to gymming, to long distance running, or to extreme sports, climbing, trekking up the mountains, should always get a checkup done prior to these extreme exercises or sports.
Okay. Yeah.
Like it did happen, Ashok and Ekta both, that a 23-year-old girl who was performing a dance performance on the stage just collapsed and died. But that could be a serious and vigorous exercise.
Yeah.
But that I think is, one should understand that exercise is meant for fitness. We are not competitive.
Yeah.
We should not be competitive. That's a different ball game. We should not indulge into that. And that I think is important because you do not know that you have blocks or you don't have. Your doctor does not know that you have blocks or you don't have blocks. So in that situation, one should play safe.
Okay. Well, Dr. Ashok, that's exactly the case. A lot of these marathoners, people who, there are doctors who've collapsed also while
Yeah.
running a marathon. So they obviously have had their medical checks and their medical work done. These are CEOs that we're talking about as well. So they have gone through that medical check. But despite that, they've still had an issue in terms of sudden cardiac arrest. So what has gone wrong or what hasn't been picked up during that medical check, Dr. Ashok?
So here is what we presume that they've had their medical checks. Firstly, a lot of this happens in smokers. Clot formation is a problem which is very high in smokers, especially during severe exercise. And many of these always say, oh, but I've had a checkup, I'm healthy. It depends upon, and then they are smokers. Now, smoking itself is a known risk factor for creating that clotting during severe exercise. So that's my first point. Second, what is the checkup they've had and what's the quality of checkup? A checkup always has to involve not a blood pressure check. So it's not just an ECG, an echocardiogram, a sugar test, and a cholesterol test. If we actually have these are major risk factors on us. And we are then able to control these risk factors in a much better manner, especially if there's a family history of a heart problem in our family. So we must understand that checkups are not expensive checkups. These are common checkups, but we need to know our risk factors. And in that risk factors, we got to control our hypertension, sugars, cholesterol, especially if you've got a family history of sudden cardiac death. We need to have an echocardiogram, which is a simple, straightforward investigation, and an ECG. By the way, it's also more important to understand that smoking is a no-no. A lot of patients come to me and say, I lead a healthy life. I do exercise. I walk daily. I eat well. Look at me. I'm so, health conscious. And then you ask them, what about smoking? Yeah, but I smoke, but that's okay. So I think we've got to understand all this. Finally, I'll also have to say, just like we've talked about, that blockages cannot be picked up by any testing. We can pick up risk factors, but we cannot pick up pre-existing blockages. So those who have a family history of a heart attack, which means any parent having died or having had a heart attack or having sudden death before the age of 60, we emphasize on them more personalized testing, which could even mean doing a calcium score on a CT, or even picking up early blockages on a CT angio, be sure that we can put in preventive factors for them at an early age between 20 and 40 so that they don't get into the same problem as their parents did.
There are a couple of people who have all these tests cleared, right? The ECG, the calcium score, but they still have these events after many years of an exercise regime, which they're still used to. So, what happens in those cases? What have they missed there?
So the basic issue is the fundamental cause, irrespective of any amount of risk factors, be it diabetes, smoking, or stress, obesity, abnormal lipids, whatever it may be. The basic fundamental issue, A, presence of a plaque within the coronary artery and the rupture of the plaque suddenly. So the issue comes, can we pick up the plaque? Can we pick up the plaque? Do we know how to treat it? These are the fundamental issues. Now, to pick up the plaque, ordinary non-invasive methods are useless. They can tell you only the function. Are the plaques flow limiting or not flow limiting? Are they there or not there? Is inferred. We do not know. We don't see. There is no non-invasive except CT coronary angio, which to some extent can tell you, yes, there is calcium, there are plaques, be a little more attentive. And even if the CT detects the plaque, at this point of time, how do we treat asymptomatic individuals? The medical science still is not decided about it. Had there been a situation that doing a plasty or a bypass carries a 0% risk and 100% success and it's cured forever, I would do it for everybody.
Yeah.
But that is not the truth. The truth is that the procedures have their own inherent risk, that the disease will progress or not progress, also it's not known. I would say this way, that like what Ashok said, that those individuals, we should weed them out. We should separate them out. Those who are at a high risk of developing coronary disease, acute heart attack, and sudden cardiac death, they should be treated intensively.
Okay.
That's all the message that I can say.
Well, Dr. Ashok, there was a case of a CEO who actually collapsed and was a very regular runner and around early 40s and collapsed one day. But one of the things that stood out was just about 4 to 5 hours of sleep for that person. How critical is sleep for cardiac health and for fitness, or for those who focus on high fitness activities?
Firstly, I must emphasize there is no single factor. It is multifactorial and it is a combination. For example, this CEO, and let's not even talk about individuals, but let's take that example. That CEO, who I don't know as a person who you're talking about, may have been doing all this, but I'm not sure whether he was a smoker, not a smoker, or she was a smoker. Secondly, lack of sleep could be just one of the reflections of many other factors. For example, lack of sleep is an important factor, but also could cause hypertension. He could be under a lot of stress, trying to meet numerous deadlines all the time. So, stress comes in as another risk factor. We don't know whether he was a diabetic or not a diabetic, but was there a family history, which none of us would know apart from he himself.
Yeah.
And therefore, yes, let us also add into the two other important things in the recent times, which added on to this multiplicity of risk factors. And that's viral infection, mostly COVID, and secondly, pollution. These
Sure.
two are the most recent factors over the last 6 years to 7 years. We've increased the incidence of heart attacks. Again,
Yeah.
like we say, a multiplication factor.
Sure.
So we must understand that when we put a single risk factor, that's not the risk factor. That single risk factor is just a reflection of a person having multiple risk factors and the person was not able to identify those multiple risk factors, which led to a heart attack. By the way, I also want to emphasize that 10% of these sudden cardiac arrests could be a viral infection affecting the heart, which leads to weakening of the heart muscle, which leads to irregular heart beating. And those irregular heart beatings can suddenly present during exercise as well. So
Sure.
there are a 10% usually of other risk factors. Say perhaps a young footballer suddenly having a cardiac arrest on the field could have a genetic disorder of a cardiomyopathy, which could have been picked up in an echocardiogram
Yeah.
or genetic testing, but he just couldn't locate that and would have
Sure.
had that.
So,
So
Dr.
we
Mehta,
must keep a lot of things in mind and not just one risk factor.
would you recommend such individuals to exercise the way they do?
Healthy lifestyle should be the way of life. It's not a treatment. It has to be practiced in your day-to-day life as a routine. And I would say that the key point is moderation. I mean, nothing is wrong in taking alcohol. Nothing is wrong in taking sweets once in a while, as long as you are in moderation. And I think the checkup, the health checkup, having established risk factors and having treated them, we must also monitor, are we achieving the targets? Are we achieving the goals? So that I think is very important. My message to people that those who are at a high risk or even otherwise should get regular checkup done. I would put now the age limit of 25 and above, and therefore control the risk factors. Absence of disease does not, absence of symptoms does not mean absence of disease. That I think is my message.
Okay. What about COVID-19 and cardiac events?
See, people are attributing it to vaccine. That I don't think so is the truth. It's not established. COVID-19 can present as a heart attack during COVID-19 time. There were many patients who came to the hospital exactly simulating heart attack, including ECG changes, turned out to have a normal coronary angiography. So they were not actually the heart attacks of the natural history that we see with the blocks and whatnot. And second thing, those who have an existing disease, it could get precipitated by COVID-19. It happened that way. So this is the way the COVID-19 played its role in posing the problem to heart patients.
Okay. Well, Dr. Seth, what we've noticed is that most of these cases take place with men and rarely with women. Why is that? Is that because they have the estrogen protection?
I would dispel that completely right now on your in your messaging. Women, the biggest cause and the biggest killer in women is heart attacks, cardiovascular diseases, the same as men. It has changed completely. It is 6 times more than any cancer, all cancers put together. And we talk about cancers in women, we talk about breast cancer, we talk about ovarian cancers, take all the prevention, but we've not emphasized to women that the biggest cause at the moment is cardiovascular diseases. So, firstly, that, and let's dispel that myth around being protected, etc. And the risk factors, by the way, are the same, but there's clear understanding that women have more severe heart disease.
Uh,
When they have heart attacks, their symptoms, by the way, can be totally atypical. It could just be sweating, nausea, vomiting, ghabrahat, and may not be typical. We also know that the ECGs in women are not entirely the same as men. And we also know that women present later because they're more interested, they're really focused towards taking care of the men folk and the family at home. And even when they have heart disease, they tend to take a backward role in that to say, oh, but I'll get my investigations done later. It's just because the sacrifices that they make for the family all the time present later, they have smaller arteries and they don't respond to many treatments as well as men. So, why are we emphasizing that? We're emphasizing that because women need to understand that any atypical symptoms in themselves also may present as coronary artery disease, and women need equal checkups as much as men to make sure that the risk factors are well understood and that well taken under control.
Hmm.
I just want to emphasize two other important things or three other important things which are very clear. And this is going to be very
Sure.
simple for people to understand. Those who have a family history of heart attacks or sudden cardiac arrest in their parents, brothers, or sisters need to start getting every checkup done by the age of 20, which should also include an echocardiogram and a blood test. And this can be done by a cardiologist and is very cheap, inexpensive. Those who are men or women, excuse me, but have risk factors of diabetes or hypertension or raised cholesterol should actually get their checkups done regularly. Otherwise, if they don't have these risk factors, like just like Dr. Mehta said, by the age of 25 onwards, they can get it done every 5 years. One of the important things about those who go for running, there's nothing wrong with people running,
Sure.
cycling for a long duration. Running, fast walking, cycling, swimming are aerobic exercises. Heavy weightlifting, gymming are anaerobic and exercises which are bad for the heart. Those who go into these aerobic exercises anyway, and those who go to gymming should have checkups done by a cardiologist prior to going for extreme exercising in a detailed manner, which the cardiologist would advise related to the extent of their extreme sports.
Sure.
It is so important that they have it done prior by a cardiologist. And finally, women need to present themselves early and understand that they may have atypical symptoms and they are a reflection of coronary artery disease, which is still the biggest killer in women. And finally, even just simple exercise of 200 minutes of brisk walking. What does it transfer to? 5 times of 40 minutes walking can decrease our chances of heart attacks by 25%.
All right, Dr. Mehta, what is it that one needs to do if in case there is a cardiac event? Or let's backtrack a little bit. What are the symptoms that one needs to respond to immediately of their own body if they think that they're having a heart attack?
Well, quite contrary to the popular belief that the heart attack is often associated with severe unbearable chest pain, in reality, the symptoms are very often mild. Discomfort in the chest, heavy weight as though mountains are on my chest, or compression or a constriction of the chest as if there is a tight bandage across my chest, pain sometimes radiating to the jaw or to both the arms, shoulders are common symptoms. Occasionally, rarely, the symptoms could be very mild symptoms, like just simply pain in the jaw.
Yeah.
My suggestion is that any unusual symptoms which has not occurred before in the trunk, be it from the jaw to the upper abdomen, should alarm an individual to seek medical help.
Okay. All right. Now, this sudden cardiac event that takes
Yeah.
place, how important is CPR and AEDs at that point in time?
I would say that people, the family where the member has suffered a heart attack, every member of the family should learn CPR. Apart from that, I think CPR should be mandatorily taught in the schools and in the colleges also. And you never know when you will be required to use it on your bystander and your family member, so on and so forth. So I think it's important. More importantly, also important for telephone numbers of ambulance, nearby ICU, family members, etc. should be handy. This I think is very, very, very important.
AEDs?
Yeah, at important public places like in movie houses, in public railway stations, etc. I think all public places AED should be available, and I think it also can be taught. In fact, in Bombay, in Mumbai, we had started. There was a move which was undertaking how to teach CPR and also AED.
Okay, all right, Dr. Seth as well as Dr. Mehta. It's been an absolute pleasure. Thank you very much for taking your time out and speaking to us about something that is so important in terms of a topic and something that we'll probably revisit as we go on. Thank you very much for taking the time out and speaking with us.